KUAM News brought to you by GTA. We start with you. Subway and Chili's Grill and Bar.
Ground zero for COVID-19. Without a doubt, they are frontline heroes, giving and sacrificing during our battle against the virus. But among a sea of documents, GMH has been doing a lot of hiring above step recruitment and not necessarily hiring frontliners providing direct patient care.
I think that the danger in this type of thing is, of course, diverting funds from other critical uses.
The issue of above-step recruitment at GMH came to light during a recent confirmation hearing for a nominee to the hospital board of trustees, who was asked about above-step recruitment for a hospital marketing and communications director. According to the October 14th petition, the starting salary at Step 1 is $60,000, but GMH petitioned for a Step 10 salary of $83,000.
I am concerned that those are the things we are sidestepping.
According to the Department of Administration's website, an agency can petition for above-step recruitment because of documented recruitment difficulty or exceptional qualifications. The petition must then be posted on the agency's website for 10 days before the applicant is hired. At GMH, they've apparently had a hard time recruiting for several positions included in the paper trail. In February, they petitioned for above-step recruitment for a data processing supervisor, normally starting at a Step 1 salary of $45,000, but GMH recruited the position at Step 10, almost $62,000. In April, for a food and beverage manager, normally starting at Step 1 with a salary of $49,000, but to be hired at Step 10 at $68,000. Also in April, for a management analyst 4, normally starting at a Step 1 salary of $49,000, but petitioned to be paid at Step 10 at $68,000. In May, for a program coordinator 4 for capital improvement projects, normally starting at Step 1 at $45,000, but to be hired at Step 10 with a salary of $62,000. In June, for Program Coordinator 3 for their Emergency Health Records System, normally starting at Step 1 at $45,000 to Step 10, $62,000. In July, GMH petitioned for above-step recruitment for a Program Coordinator 4 for fiscal. This position normally starts at a Step 1 salary of $49,000, but GMH petitioned to hire this person at Step 10 at $68,000. In October, for a hospital chef supervisor, normally hired at Step 1 at $37,000, but recruited at Step 10 with a salary of $51,000. Also in October, GMH petitioned for the creation of a position for a Deputy Assistant of Administrator of Operations. The Step 1 is at $70,000, but GMH recruited the individual at Step 18 at $125,000. And apparently that deputy will serve as the assistant to the Assistant Administrator of Operations, jumping from a Step 1 salary of $76,000 to a Step 18 salary of $134,000.
We have critical needs at GMH that must be prioritized. And if we cannot fill nursing positions, nursing positions determine how many beds we can fill over there. And we've been paying exorbitant amounts for traveling nurses, and we still have gaps in nursing. And I always believe those are critical. The hiring of specialists is, of course, critical. And there's been, so much talk about, why is GMH not hiring specialists? Well, they have all the authority to hire specialists and to set salaries for medical professionals as needed. In other words, if specialists are hard to recruit, we want to put money into that and recruit them.
All these steps have led GMH to now have to take a walk down to the legislature. Speaker Terlaje plans to hold an oversight hearing next month on the hospital's hiring practices and vacancies.
How do we say in one breath we're trying to prioritize the recruitment of nurses, specialists, and other medical professionals, and then we hire above step for other less critical positions?
The speaker also plans to call in the Guam Behavioral Health and Wellness Center to look into their hiring as well.